Good afternoon. Welcome to St. Clair County's daily briefing. Joined here again with Chairman Mark Kern and also Sam Bierman from the Health Department. Sam, as always, welcome, and you get to be the burden of the numbers.
Yeah, and unfortunately, the bearer of bad news. I don't think anybody likes seeing me come on because most of the time the numbers that I have continue to rise every day. But as we have done in days past, the numbers that we will report today are St. Clair County residents that have been tested. And as of today, we are at 1,360 that have been tested with 327 positive results. And that includes 15 new positive test results from yesterday. And that includes both males and females from the age ranges of 20s all the way up to 100s. We have 972 negative test results with 61 test results still pending. And we are currently holding at 19 deaths, so no new deaths to report today. For state totals, we are at 164,346 that have been tested. We are at 35,108 positive test results, which is an increase of 2,049 since yesterday. And for deaths, we are reporting 1,565, which is an increase of 97 from yesterday. And our condolences go out to the families who have lost loved ones to this virus. Hospitalization numbers, and these are for hospitals that are in St. Clair County. Currently, we have 61 patients admitted for COVID reasons, and 5 of those patients are on ventilators. Long-term care facilities in St. Clair County that are currently listed at outbreak status, which means that they have 2 or more, and that can include staff and or residents that are COVID positive or have COVID symptoms. Brea of Belleville has 12 positive cases with 1 death. Colonnade of O'Fallon has 2 positive cases and no deaths. Four Fountains in Belleville has 17 cases and 1 death. And Memorial Care Center in Belleville has 14 cases and 1 death. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. We appreciate you coming in every day.
Absolutely, we're happy to be here.
Given the real numbers, which we appreciate. So we have a lot of what people have talked to us about is I'm at work and I'm in the workplace and I don't think my boss is doing the right thing. I don't think they're practicing the guidelines we need at work with social distancing. And so the Office of the Attorney General of the state of Illinois came through with guidance for anyone that has a complaint. If they think their workplace isn't treating this seriously and not treating it right, there's a phone number with the Workplace Rights Bureau, and it's 844-740-5076. And you can call that number to talk to someone about whether or not the guidelines that your employer is using are appropriate and proper and are keeping you safe. This time we'll go into our zip code reports for the day. As always, if your zip code isn't mentioned, it doesn't mean that there isn't a COVID positive person in your zip code. It just means that we haven't reached that level of 5 yet. So these are currently the people that are diagnosed and the number of people that are diagnosed in these particular zip codes. In 62201, we remain at 8. 62203, the number remains 11. 62204, the number remains at 9. In 62205, there are currently 11, and that is an increase of 1. In 62206, there are 30, that is an increase of 6. In 62207, there are 18, that is an increase of 1 COVID positive person. In 62208, there are now 22, that is an increase of 1. In 62220, there are 26, that is an increase of 4. In 62221, there are 29. That is an increase of 1. In 62223, there are 21. That is an increase of 1. In 62226, there are 51. That is an increase of 6. In 62258, there are 11, and that number remains the same over yesterday. And 62269, there are now 27, and that is an increase of 2. So as you see, we continue to have increase of positives in our county. Our deaths remain the same today. That's good news. But our thoughts and prayers do go out for all of those victims, not only in St. Clair County, but statewide, of COVID-19. It has been a tough time for many, and certainly for those that have experienced a loss, it's even tougher. So today we welcome to the panel Dr. Venkat Anjan. He is a cardiologist with Prairie Cardiology Consultants at St. Elizabeth's Hospital. Doctor, welcome.
Thank you for having me.
Thank you for coming in. So let's just dig right into it, Doctor. So you being a cardiologist, you see people that are coming in with heart attacks and heart attack symptoms. It's what I think you're experiencing is that people are hesitating to go to the emergency room now because they're afraid of catching COVID-19. Go and dig into that a little bit and tell us why that's a bad idea not to go to the emergency room, and that if they go there, they can be assured that they're going to be safe.
Sure. So what we have seen locally, which is a nationwide phenomenon since really the shelter in place started, is admissions for heart attacks have been going down across the country and locally. And why that's concerning is because luckily over the past 20 to 30 years, modern medicine has been able to treat heart attacks effectively, which has saved lives because we were able to treat not necessarily cure heart attacks, but alleviate the problem relatively quickly. And we have systems in place to do that. However, when people are afraid to go to the hospital, especially because of the ongoing pandemic, that you end up utilizing the systems that are in place. And as a result, some of the long-term ramifications of heart attacks and even short-term ramifications could lead to things like congestive heart failure. It could lead to fatal complications of heart attacks that we rarely have seen in the past 20 to 30 years.
So a person, say, for example, a person's out there and they've got terrible chest pains. Normally, they would go to the emergency room. You would see that person, and if warranted, they would get a catheter, a heart cath put in right away, and it would help them to get through their heart problem.
Correct. Yeah. So if somebody comes to the hospital and they're having a heart attack, they would get a cardiac catheterization immediately and potentially an angioplasty with a stent placement to basically allow blood flow to go to their heart. Whereas if you did not come in, the blood flow to the heart would remain cut off and heart muscle would continue to die.
And so by not going in, people are thinking, well, I'm not going to get COVID-19, which is a terrible thing to catch. But on the other hand, they're doing damage to themselves that is permanent.
Correct. And that's exactly right. And luckily, we have systems in place at our hospital and I think all the hospitals locally to treat patients safely for a heart attack and other medical conditions and to prevent them from getting coronavirus.
So the rooms where people are seen, they're not connected airwise with the room where a COVID patient is. And that process starts outside of the hospital. So we have already basically are diverting patients who we are concerned about coronavirus to one part of the hospital or one part of the emergency room immediately, whereas other patients who come in for traditional things like chest pain or broken bones or stomach pains, they would go to a different part of the emergency room so that we keep the patient separated. So I know that this then applies to other things like strokes, and everyone says if you are having a stroke, you get to the hospital and get treated, and if you get treated within the first 24 hours, you're much better off than if not.
It's actually quicker than that. So we recommend for patients who think that they're having a stroke, so things like you're having difficulty speaking, if you're having difficulty moving your arm or you're having difficulty moving your leg, those are emergency signs and symptoms that you cannot ignore. You should go to the hospital immediately, and we treat strokes effectively within the first 3 to 6 hours of symptom onset.
And so even an appendicitis, so we talked a little earlier, I assumed that if you were having an appendicitis attack that you had to go to the hospital because the pain would be so terrible. But you think people can wait out even in appendicitis?
Yes, I do think that. I mean, we've anecdotally have already seen it, that people can wait out something that. I mean, I had a patient, something as simple as appendicitis, but I had a patient tell me, how could somebody, a patient who had a heart attack, and they said, how could somebody withstand staying at home through a heart attack? And I said, well, it happens a lot, more frequently than you think. So I know that people are scared, but this virus is going to do a lot more collateral damage if we're not able to treat the conditions that we can treat well.
And so the capacity at the hospitals, the part of the story you told, the person thought that the hospitals were jam-packed right now.
Correct. There is a common perception right now that the ERs are overflowing with patients who are coronavirus positive. Frankly, that's just not the case. We are well equipped to handle patient volumes. I don't have the exact numbers, but I think our emergency room visits are actually lower than what they normally are because of the coronavirus pandemic. So we're actually used to seeing more patients than what we're currently seeing. And so if you think something is dramatically wrong with your health, I would not ignore those symptoms and get seen immediately, because it's not worth suffering potential long-term or short-term harmful ramifications of those things.
So you're balancing the risks.
Correct.
If a person's already been in and had some work done, you're now providing what's called virtual visits. Mm-hmm. Can you talk about that?
Sure. So this is something that we're providing through Prairie Cardiovascular, and I know also the HSHS health system is providing virtual visits. So luckily for patients who have a smartphone, a computer, or a tablet, we can provide continuing medical care without seeing people actually in the office in person. We are recommending that, especially for our higher risk older patients, so that we can still provide regular ongoing medical care. We can refill medications, we can answer questions, we can order testing that needs to be done on a timely manner, so that people don't ignore any symptoms, or if they are too afraid to go to the emergency room, then it's very easy for us to set up a virtual visit. So at least we can meet with the person, or it's their normal provider, and they can go over any questions that they may have.
But if you need to go to the hospital because you're experiencing symptoms, go to the hospital.
Correct. Yeah, it's we have. Medicine has spent the last 50 years trying to make heart attacks a life-saving an issue that we've worked really hard on doing that, and now is not the time to just let that go by the wayside.
So do you have any other advice, doctor, while you're here?
The advice I have, I think honestly, locally, from what I've seen, people are doing a very good job of socially distancing. I think that is good, but the things that I would be very concerned about is new onset chest pain. If you are a cardiac patient and you have new chest pain, I think that you need to take that very seriously. Other things that, like I mentioned before, signs of a stroke, difficulty talking, new onset, not able to move one of your arms or your legs, those are things that need to be addressed immediately.
Okay, we sure appreciate it. Herb?
Doctor, thanks for coming in today. Just a couple of questions, follow up from some of the viewers yesterday. Are you able to explain to them the difference of the symptoms from this COVID-19 and the common flu, as they call it?
Sure. As far as I understand, symptoms of COVID-19 as opposed to a common flu, one thing that we see is, fever is common and body aches are common. But what we see with COVID or the coronavirus is you often get a dry cough, which means that you're not coughing up mucus. What we also see is people feel very short of breath, but they're still able to communicate very effectively. Whereas usually with the flu, you tend to see people when their oxygen goes down, they're not able to communicate appropriately. they're much more visibly showing that they need to work hard to breathe. And then there's other things that we know based off of some of the medical imaging that are available. Other unusual things about coronavirus that we're learning: a loss of taste and a loss of sense of taste, a loss of sense of smell, and also more kind of stomach complaints, nausea, vomiting, diarrhea.
Okay,
Is more common with coronavirus as opposed to the common flu.
And you talked earlier about one of the reasons people are scared to come to the ER possibly because of the coronavirus. Is it true to say, or that anybody that comes in there with those chest pains, when you come in, you're going to be treating that patient as if they have corona already because your main concern is the cardiac part?
Correct. I mean, we have ways of basically risk stratifying patients with chest pain. So high risk patients that we feel need to be treated immediately, we are assuming that everybody has coronavirus and are taking the necessary PPE precautions. So we have all the equipment to protect us and the healthcare providers, and then we also have the facility to make sure that the virus does not spread. Now, in some of the patients that we deem to be in the maybe intermediate or low risk category, sometimes we do end up testing them for COVID-19 first, and then if we deem that they're negative by our test, then we can address their cardiac complaints safely without necessarily taking all the we're taking precautions on everybody still, but we're not necessarily taking the full N95 precautions on all those patients who end up testing negative.
So the lesson learned here today should be, if you feel those chest pains or, as you said, some of those stroke symptoms, don't hesitate. Come to the emergency room to where you can get that preventive.
Yeah, and not a lot of times the education that we give for patients who feel that those things are happening, we actually say call 911. I mean, calling 911 is one of the safest things to do in those situations. God, people who are having a heart attack, we don't always like to have them drive behind the wheel just because of something potentially bad happening. So 911 is always a good resource to use. Me and my colleagues, we work with the paramedics locally and in surrounding counties, and they do an extremely good job of getting patients to the hospital in a timely manner when they think they're having a heart attack.
And there's a lot of work that they can do once they get to the house.
Correct.
And that preventative pre-hospital care.
Yeah, this is they're professionals. This is what they're trained for.
Yes.
They know how to transport a patient from their house to the hospital safely and get things started.
Very good. Thank you, Doctor. Appreciate you coming in.
Thank you. Appreciate it. Thanks for having me.
Thanks, Doctor. So, we're talking about being in the middle of this right now. Part of the way we're going to get through the COVID-19 pandemic is the next step is going to be through testing of anybody who feels a symptom, or even beyond that, just a testing of everybody in the process, so that we'll know who has had it, who has it now, who doesn't have it. Those are going to be identifications that are going to be absolutely necessary if we're going to get our lives back to normal. Testing is expensive, and testing requires a lot of additional people. It requires you to do some work, which we talked about yesterday. Keep a diary of all the people that you're in contact with for more than 10 minutes. Certainly if you're closer than 6 feet, remember to write that person's name down, so that if you do come down with COVID-19, it'll be simpler to find out who those people are, so that they can be tracked, they can be traced through the process. This process costs money, and we all assume that our healthcare industry has all of that and has all of that in hand. But in a case like now, during a pandemic, governmental funds come into play. And our next guest here today with us is Jay Hoffman. Jay is the Illinois State Representative from the 113th District. And early on, Jay, you were a huge proponent of increasing testing, and you fought for some dollars. Let's talk about that. Let's talk about testing in St. Clair County.
Well, first of all, Mark, thanks for having me, Chairman. I guess I was here 3 weeks ago now, and Your hair was shorter. So was mine. But I really hope that we wouldn't have to be still doing this 3 weeks later. But I think part of the reason we're still here doing this is there wasn't early testing. The testing just simply wasn't available to identify people who may have had a high temperature, who could have been tested and have been found positive, and then tracing and seeing who they were with, as you indicated, making sure that you trace back who you've been with. If you're tested positive, they then get screened, and if they are self-quarantined or they actually have to have tests because they have symptoms, that is actually done. So there's good news on the testing front. For a few weeks now, we've had Memorial Hospital has put a drive-through testing facility at the Swansea location right off of 159, and I believe that the Department of Public Health, the St. Clair County Department of Public Health, has all of this information, or will have all of this information on their website. But this week, East St. Louis opened up by the Windsor Medical Center. There's drive-through testing there. By the end of this week, it's my understanding, on the west end of Belleville, through Southern Illinois Healthcare Foundation, at their office location, there's going to begin drive-through testing. Koki is going to open up a testing facility through Southern Illinois Healthcare Foundation soon. I think hopefully by Friday or next Monday. And then finally, I believe in Granite City, if you're for our friends in Madison County, or if you live in Brooklyn or you live in East St. Louis, you can go there as well if you want to. We're not saying you have to be a Madison County or St. Clair County resident to be tested in any of those facilities, but we've worked real closely with Southern Illinois Healthcare Foundation in order to get these testing facilities up and running. The state, we now, in Madison or St. Clair County, we now can test relatively easily and locally a significant number of tests per day. So if you have the symptoms, you should call 618-646-2596. That's 618-646-2596. And that will get you with the people who are screening at Southern Illinois Healthcare Foundation. Or you can call your own doctor, obviously, and they can order up a test if you have the proper symptoms. Now, we've been working extremely hard with the Illinois Department of Public Health to have them relax some of this testing criteria. Now that we have more tests available, we'd like to test as many people as possible because, number one, you can identify whether or not they actually are positive, but then you can put in place a tracing system that we're working with the Department of Public Health as well as the Eastside Health District to try and actually trace back people you've seen over the last few days and see if they too have the symptoms or if they need to be tested or self-quarantine. I think only through this will we be able to safely open up, get our businesses back working, and get people back to work.
And to talk about numbers, so we've been doing this for 40 days, this program, approximately. 42 days. In that entire time, we've tested 1,360 people in St. Clair County. By you bringing this money in and the other state representatives, state senators from this area, you're going to have the capacity to do 560 tests a day?
Actually, in addition to the tests that can be done and have currently been done by the hospital systems and by some local doctors, we're going to have in Madison and St. Clair County a minimum of 350 tests per day. So I think when you add it all on top of each other, it's probably about 500 per day. That's the capacity. Now, we need to loosen some of the criteria for testing so that, and this is just me, I'm not a doctor or a healthcare expert.
You're not?
I'm not. I listen to a lot of doctors and healthcare experts, and can I tell you, if I have a symptom, I'm going to the hospital, and I'm going, whether it's chest pain or anything like that. I talked to some of the heads of the hospitals here in St. Clair County and Madison County constantly over the last 40 days. There really is a reduction in the number of patients that are in hospitals. I believe that at Memorial alone, there's about a 50% reduction in the number of people that are actually in the hospitals. And that is because elective surgeries and other types of things have been put off. I think this is just me, and I'm not the governor, but I've made it known to the governor's office that I really believe that we can loosen up some of the restrictions on the healthcare professionals, so that we can get some of the elective surgeries done. Nobody knows how to treat infectious diseases better, I think, than hospitals, and we should rely on them to make sure you have the social distancing in place, but also let's make sure that we don't have to lay off all those healthcare workers because we don't have that we are not putting people into medical care that needs medical care.
So today I was on a call with you, and as part of the testing, then comes the tracking and the tracing. And you've worked hard to try to make sure that when we ramp up, we're going to be doing in a span of 4 days, just with Southern Illinois Healthcare Foundation's testing, what took 42 days to get to here. So that's going to require that many more people then to be on a telephone to call that list that's going to be in people's diaries of who they were in contact with. And you work to try to make sure that that pipeline then is not a bottleneck.
Yeah, we're working currently, and I'm hopeful that it'll come to fruition. We're working currently with the Southern Illinois University School of Medicine, and working with some of the nursing professionals at SIU Edwardsville, where they have a nurse practitioners program as well as a nursing program, so that we can take the professionals, put them into the healthcare system, the public healthcare system, so they can help with the tracing and the tracking. Now we're in the infancy stages of doing that, but I want the Metro East, and I know that all the legislators who represent Madison, St. Clair, Monroe, Clinton, Randolph counties, all of us want to have the most robust and be the gold standard for testing and tracing throughout the state. I think we can do that. I think we're well on our way to doing that, and hopefully within the next week and a half to 2 weeks, we're going to see the results.
And currently we are tracking and tracing. It's just as we see these numbers going up. So, today we had 15 new COVID positive people. I would assume that when we do 350 additional tests, that number is going to rise significantly, because there are people out there, we've been told, that have COVID-19 that may not experience all of the symptoms. They may be well enough to medicate at home. We're going to find out about all these people as we increase the testing. So that tracing and tracking is being done. What we're talking about is you providing us not only the increase in tests, but the ability to track and trace those patients.
Well, unfortunately, and I've said this before, and I think I said it the last time that I was here, this is a national healthcare crisis that unfortunately is being run on a state-by-state basis. Now, I'm not trying to be critical. However, the tests just weren't available. So the criteria for who received the tests early on when the pandemic took hold had to be very, very tight and very limited because of the number of tests that are available. Now we're starting to see more tests become available. We'll be able to test more people. We'll be able to track more folks, and I hope get control of the spread of COVID-19. I'd like to just mention one other thing, not related to testing. Our office is open, even though my assistants are working remotely. You can still call the office. You can get assistance. We been inundated with individuals who unfortunately have been laid off or furloughed or for other reasons have lost their job as a result of this pandemic. And you can call the office. That is 618-416-7407, 618-416-7407. We're still answering the phone. You can also email at repjay, Hoffman, Hoffman, at gmail.com. So you can either call or you can email. Either way, we're going to try and help you. There is a huge backlog at the Department of Employment Security. However, we want to make sure that everyone who is entitled to unemployment benefits can get them. Right now, because of the system not being big enough or large enough to take the number of applications, if your last name begins with an A or an M, A through M, you can call on Tuesdays, Thursdays, or Sundays. You're better off going to the IDES website. You'll get through easier. Or if your last name starts from an N to a Z, you can go to their website and apply on Monday, Wednesdays, and Fridays. And on Saturday, any letter your last name start with any letter can have access. But if you need something, please feel free to call our office. We'll do our best, but there is a backlog at the Department of Employment Security.
And the numbers I've heard is that you're dealing with the number of calls a day that you used to get in a month.
Yeah.
That's
why you're better, or I'm told you're better to go on the website as opposed to calling. Right now, even though they've added significant number of people, they are only capable of taking between 8,000 and 10,000 calls per day. They're averaging about 100,000 people per day trying to call that number. So go to the website. It's on the coronavirus Illinois website in the frequently asked questions, and you can go right to the IDES website.
Thank you. And I just want to say we've been on the phone consistently. It's always a problem that I'm presenting you with. Even at one point, trying to find swabs for testing. I mean, when you talk about how the government, on a national level, wasn't prepared for this, we were on a call one time. 500 swabs was a big deal for you to be able to bring that in to make sure that testing continued. So we appreciate all that fight.
I never thought I'd be a procurement officer. That's what
Well,
I
you're
am.
good at it.
I got a future.
Herb Simmons.
Well, Jay, I would say don't hold it against the chairman for calling you so much, because I'm the one that's usually saying, call Jay. I need PPEs. So we appreciate all the help you do. Speaking of the PPEs, we had 11 of our agencies pick up some of those supplies today, thanks to Representative Hoffman and other representatives. We continue to get not always what we need, but they get us what they have access to. But we appreciate that. Today we also had a conference call with IEMA over the alternative housing plan and the locations of them. Had a conference call with IDPH today, and also a conference call with the hospitals and EMS agencies. That was a lot more networking that we do. You heard those numbers from Sam today. 2,049 new cases statewide and 97 new deaths. And as we tell you, there's only one way we are going to stop those numbers, and that's by everybody staying at home. And as I tell you all the time, you can either be part of the solution or be part of the problem. And those of you follow us here every day at these briefings and leave your comments, we answer them, and we appreciate the support. For those of you who are still kind of negative, I hope these numbers sink in sooner or later, and you start understanding staying home and staying alive is how we will stop this. We'll be back tomorrow afternoon at 3:30 with our next briefing. We'll be back momentarily with Cindy to deliver our translation into our Spanish communities. Thank you.